Hello, everyone. Welcome to our April edition of AMA with Dr. Ben. I'm Dr. Ben Behnam, a board certified dermatologist, founder of Happy It, and chief medical officer at Happy It. Thank you so much for joining us on another Happy It's AMA. So, before we get started, I just want to remind you guys that this information is for educational purposes only and is not meant to provide medical advice or services. Please do not rely on this information to make any medical decisions, and remember to discuss the risks and benefits of any treatments with your own medical doctor before starting treatment. This does not establish any patient-doctor relationship. So what we're going to do, basically, we're going to go through some of the questions. I'm going to answer them. And if you guys have any questions, please post them up and we're going to answer them. So what is the happiest sign-up process like? So it's actually very simple. You just go on the website and you fill out a short questionnaire, and the system will ask you to upload your photos, because all this information is going to be sent to a physician who's going to evaluate your medical history, your past medical history, your hair loss history, and your photos, so that they're able to customize the correct solution for you and send to the pharmacy. So, but the process is very simple. Probably takes about 5 to 7 minutes to the whole happy Head process. Uh, do you have to be on a subscription? Well, in order for the medication to work, you have to use it for many months consequently. So Happy Head by definition is a subscription, but you could just order one product and I guess see how it is and kind of message the system or customer service team and tell them basically to kind of pause things, and you could pause things on the back end as well. But for best results, patients that get the best results are the ones that get the product on a monthly basis and stick to it for at least 4 to 6 months. Uh, are there any age, gender, or ethnicity requirements? There are no ethnicity or gender requirements, uh, but by law, since this is a medical prescription drug, you have to be at least age 18 and above. How can I talk to my assigned dermatologist? So, first of all, we do have hair specialists that we could talk to. And if you do want to talk to your dermatologist, once you sign up, you get access through the system. Basically, when you log into your account and you're a son dermatologist, and through that, through your account, you could actually message your dermatologist. Uh, does it work on completely bald people? Unfortunately, no. Happy Head does not work on bald people, because the reason is any hair loss medication works when you have some hair. Basically, what it takes your natural hair and it thickens it up. So if you're completely bald, there's no hair there at all. So it's just not gonna work. What is Okay, somebody said, I live in Iran. How can I get it? Unfortunately, Happy is currently in the US only, and we cannot ship it internationally. What is the best starter product? So we noticed through thousands and thousands of patients that the patients that get the best results are the ones that start taking a topical medication and oral medication at the same time. So if you go on the website, basically the best starter products are the ones that people do topical and oral, the combo pack. In addition, there are many different variety of medications. There's finasteride and dutasteride. It's the dutasteride that we see patients that have best results. In clinical studies of oral dutasteride compared to oral finasteride, dutasteride showed better efficacy compared to oral finasteride. So dutasteride is a better drug, and this is the year of dutasteride, guys. You want better hair, dutasteride is the drug of choice. So that's a good starter product. And if there's any questions, you could always reach out to happyhead.com/help, and there will be someone to help you out. Or please give us a call. We have hair specialists that could help you. And if we can't help you, we could always have you sign up and have you and your doctor try to come up with a customized solution for you, because we do understand that everyone's hair loss is different and every person is unique. So our goal is to come up with a unique customizable product just for you. That's why your medical history and your photos are very important when you submit your consultation. um, some are worried that the products affect other hairs on our body. Is that true? So so let's talk about this. um, Usually with finasteride and dutasteride, it mainly affects the hair on your scalp. Oral minoxidil, however, could affect basically other hairs on your body. You're right. Oral minoxidil could give you overall body hair growth. So if you are like a young female in like from certain ethnicities like Middle Easterns, a little bit darker, yes, you could get more growth on your face only on the oral minoxidil. It could also happen with the topical minoxidil, but it's less rare. So, but again, but this is why it's so important that basically you talk to one of the hair specialists and submit your medical history to our doctors, because based upon your medical history and based upon your concerns that you voiced to us, we could customize the solution for you. There are many different medications. There's finasteride, dutasteride, minoxidil, and spironolactone. And based upon your gender and ethnicity and your concerns, we could customize the medications. So if you're like for example, like a young so I'm Persian, so like a young Persian woman in their 20s and doesn't want to have any hair on your face, we're not going to give you oral minoxidil. There is basically oral spironolactone that we could do, or we could do topical minoxidil. So again, everyone's different well, based upon their age and ethnicity. So the consultation with the dermatologist is really important. Um, is hair loss genetics? The answer is yes. Majority of the time, the hair loss is genetics, but other factors also do play in it. So, for example, hormonal factors, like such as like test your testosterone and DHT levels, what you eat. So, for example, if you take like a lot of creatine or other vitamins that contribute to elevated DHT or testosterone level, if you are vegan or not, if you eat a lot of protein in your diet or not, um, levels of stress or traumatic events in your life. So there are a lot of factors that go into basically hair loss. So it's not all purely genetics. There are also a lot of environmental factors. Again, doing that initial consultation with the doctor is very important to figure out exactly what's really contributing to your hair loss. Is happy head preventative? Um, so this is a very good question, and the answer is that if you are at the beginning stage of hair loss and you begin to notice something by using happy head, yes, it could prevent additional hair loss. Should a woman in menopause take spironolactone or something else to block DHT? So if you're a menopausal female, the best one to block DHT is actually oral finasteride or oral dutasteride. From a clinical perspective, as a dermatologist who practices every day, seeing a menopause female patients with hair loss, I've noticed that oral finasteride or oral dutasteride does a way better job at blocking DHT compared to spironolactone. And honestly, it has much fewer side effects than spironolactone as well. Remember, spironolactone is a blood pressure medication that used off-label for hair loss, but it has other issues as well, like breast tenderness, enlargement of breast, irregular periods in younger females, non-menopausal, changing your potassium in your body, so you're gonna have to watch out not to eat stuff that are high in potassium. So again, so if you're a menopausal woman, uh, I recommend finasteride or dutasteride, not spironolactone. How would I know when my shedding has turned into hair loss? Well, great question. Um, remember, first of all, what is the definition of shedding? I mean, if you're losing 3, 4, 5, 6, 10, 15 hairs, I mean, I really don't consider that shedding. If you're losing 70, 80 hairs a day, yeah, I would consider that shedding. But remember, some people could lose up to 50 to 100 hairs a day, and that could be normal. When does shedding turn into officially like hair loss? Well, when you look at your scalp and you start to see the scalp, that's when you officially have hair loss. Again, the most important thing about hair loss is to be proactive. So if you start to notice more hair loss compared to your average, then that's when you want to be proactive about it and start getting on happy head to prevent and reduce that shedding so you don't get the hair loss. What ingredients are in your multivitamins, and do I really need to take 4A? So great question. So we don't have oh yeah, we do have a multivitamin here. So let me show it to you guys. Thank you so much, Jeremy. Thank you very much. So yours is the Happy and multivitamin. A lot of thought and efforts has really gone into making this multivitamin. So the key ingredients is biotin, uh, collagen, keratin, vitamins A and D. And those are really key along with ashwagandha and probiotics. But what makes really the happy vitamins unique is because of the fact that you see your hair is composed of amino acids and protein. So the more protein you uptake, the more amino acids you have in your system, the better results you're gonna get. So our happy basically has a lot of vitamins, has a lot of collagen and probiotics, which are essential basically for really good healthy hair. And the reason why you have to take 4 days is because you're gonna have to take enough of those in order to get enough of those collagen and probiotics into your system. What is the best time to apply the topical medication? So we usually say do it morning and night, twice a day. How does the liposomal medication work? So the happy liposomal is a very, very unique formula that really honestly took us a long time to develop. What's unique about it? Um, what's unique about it is that the vehicle is made in such a way that it prevents absorption systemically. As a result, less systemic absorption means less systemic side effects. Um, do you recommend taking oral and applying the top points together daily? We have seen in our own patients that do oral and topical medication are the ones that end up with the best results. And the reason is because when you're taking orally, it goes come from inside to your scalp. When you apply topically, you have this topical local effect. So it's called sandwiching. And when you do both together, you will see better results. How effective is the happiest shampoo and conditioner? Well, look, I don't think the shampoo and conditioner it's like magical or a game changer, but together in conjunction with our topical happy medication and the oral medication, they all work together to give you the best results. What is the ideal hair care routine, and how often should I be washing my hair? So um, I don't think you should wash your hair. You should shampoo every day. I mean, you should wash your hair every day, but I would recommend shampooing basically every other day. The hair care routine would be basically, you wash your hair, not necessarily with a shampoo, just wash it out, and then you come out and you can apply the Happy Hair product and every other day basically with shampoo. What is the advanced formula and how is it better? The advanced formula is a very, very unique formula where it combines minoxidil with two different DHT blockers, finasteride and dutasteride. And along with retinoic acid, so there's four things all combined together. It is our strongest topical medications thus far, and I don't think anyone else, honestly, in the universe has this formula. It's our formula. Uh, it's better because you're having two different DHT blockers, finasteride and dutasteride. So you're inhibiting the 5-alpha-hydroxylase 1, 5-alpha-hydroxylase 2. You also have prescription grade minoxidil 8%, which is stronger than anyone else on the market. And we also have some retinoic acid, which has been clinically shown to increase absorption of minoxidil into the system. Do you recommend dry shampoo? Uh, so yes, you could use a dry shampoo for patients that have very like oily scalp. So yes, you could do it, but not necessarily for everyone. My hair is very sticky after applying the 8% minoxidil. Is there anything I could do to avoid this? The sickness comes from the fact that in order for us to reduce the irritation from the minoxidil, we did add some aloe to it, but we could take that out. Remember, Happy is a customizable formula. So why don't you reach out to our customer service, happy.com/help, and say, look, can you please take out the aloe vera from my minoxidil? And we'll be more than happy to do that for you. And then it will be less sticky. What makes Happy different from other companies like Hims or Keeps? First of all, we're the only top company that's in the hair industry that we have board certified dermatologists seeing the patients. Other companies have like a PA or nurse practitioner. We have board certified dermatologists that evaluate your medical history and write the prescription for you. So our dermatologists are trained in hair. They went to school many years basically to become dermatologists. So they know a lot about hair. So they're much better able to analyze and evaluate you, come up with a correct diagnosis, and give you the best treatment. Number two, Happy is the only product that's customizable, which means let's say you don't like the aloe in your product, we just let us know, we take the aloe out, we customize the product just for you and ship it out. Let's say that finasteride is not working for you. Well, we're going to customize it for you, switch it to test drive and ship it out to you. Let's say the minoxidil is irritating, we could switch it out, we could go from 8% to 6%. or take it out. No other company customizes products like this and sends it, ships it out. And by doing so, this means that we literally look at every individual person as an individual and we customize the products for them. Whereas the other competitors is just one product, one size fit all, and we don't do that. And also with them, they mass produce the products and it's sitting on shelves for many, many months. Whereas ours, we literally producing it for you fresh, customizing it, and then shipping it out. Why can't Happy It be shipped to Europe? Well, we currently don't have dermatologists in Europe basically to prescribe the medication, so we're only remain in the United States. Where is Happy It, headquarters office located? Happy is located on the west side in Los Angeles, right above our dermatologist, actually, dermatology office. So if you're ever in LA, please come visit. We're right here. Does finasteride and testosterone cause initial hair shedding prior to growth? Typically not. The initial hair shedding is mainly associated with minoxidil and not finasteride nor dutasteride. Now, it doesn't mean it can't happen, but it's just very rare. How did Happy It get started? Well, Happy It got started from products in our own personal office. I'm a board certified dermatologist and I do a lot of hair loss. Dr. Sean Behnam, my brother, is a hair transplant surgeon, and around 2017 2018 we were looking for an alternative to oral minoxidil, to oral finasteride that doesn't have much sexual side effects. So we came up with a topical finasteride and combined it with minoxidil, and we had the Happy products in our office for several years before we launched it nationwide. And the reason why we did that was because there were a lot of patients calling our office and wanted the formula, and we couldn't really service them because we're only in California. So we set up Happy to be the first nationwide distributor of topical finasteride in the US. Are there optimal DHT levels in the blood? That's a very good question. So please understand that DHT, so testosterone gets converted to DHT, and there's serum DHT and there's also scalp DHT levels. Um, there's always a range. So when you do a blood test, basically that blood test, that lab will give you a range of the CMDHDs, and actually it changes from lab per lab. So as long as you're not like too high or too low, as long as we're in the middle, I'm happy with it. But also you have to realize that serum DHT doesn't always correlate to amount of hair loss. And the reason is because DHT bonds to your testosterone DHT receptors. And what really controls miniaturization is really that affinity of DHT receptors to amount of to your DHT. So if your DHTs really have really high affinity for those DHTs, and we have a very low DHT level, it's still gonna bind and cause miniaturization. So testosterone and DHT level always do not correlate to hair loss. Does the topical have a scent and does it create buildup? Does it have a scent? Typically not. I don't think our topical, no, topical does not have a scent. Um, does it create buildup? I mean, in some patients, it could create some buildup. It really depends upon the individual. Sometimes the also could cause some irritation on the scalp. So again, everyone's different. If that happens, you could definitely let us know, and we could switch out the formula, see if other formulas may work better for you. The liposomal formula doesn't really create any buildup at all. The liposomal is more of a cream lotion composition, so it goes on actually really well and does not cause buildup. Where are Happier products made? The prescription Happier products are made in two of our distributor pharmacies. One is located in New Jersey, the other is made in Pennsylvania. Basically, all made in the US. And all of our vitamins and shampoos, they're all manufactured in the US. Is it okay to combine topical finasteride with the other medications and serums? Typically, yes, but again, specifically, if there are any specific questions, just let us know or ask your dermatologist through by logging to your account. How is the advanced formula stronger than topical dutasteride? That's 0.3% versus the 0.1% of dutasteride in the advanced formula. So our topical dutasteride formula is dutasteride 0.3% along with minoxidil 8%. Our advanced formula is dutasteride 0.1%, finasteride 0.1%, minoxidil 8%. Um, so the question is, the regular dutasteride formula has a higher concentration than the advanced formula. So why is the advanced formula called advanced? It's because it combines multiple different DHT blockers. It combines dutasteride and finasteride combined together. So although it's a lower concentration, but there are more ingredients in it. So guys, now let's talk about some of our account page information. So first of all, Happy is a subscription service because we have noticed that when you get the products auto-filled and shipped to you on a monthly basis, you're going to be more consistent with it and you will see better results. You can do a self-serve online on your account page once you have placed an order and have created an account. You can request to adjust your subscription frequency, put on a hold, and also change the refill dates at any time. Overall, look, we cater to you. So, look, if you don't need the products, you could always pause it. You could skip a month, change your dates. And if you can't do it online, you could always go to happyhead.com/help and message one of our customer service representatives, and we'll be more than happy to help you. Also, if there are any side effects with the product, please go to our help desk. And if you want to customize your product even further, remove things or add things, please let us know. Happy assigns you a board certified dermatologist. We don't use PAs or nurses. We have board certified dermatologists who you contact via HIPAA secured patient doctor chat. So when you talk with them, it's all HIPAA secured and it's confidential. We also have a team of hair loss specialists at your disposal. And the way you can reach that is by happy.com/help. Somebody asked a question. I've been using this for 2 months and I haven't seen any relief. Well, here's the thing. Hair loss goes through many different hair cycles, and it really does take 4 to 6 months for you to see best results. So please be patient. I saw a patient in the office yesterday, and he was using it for about 7 months, and he just started to see results. Everyone's different. Your results may vary compared to someone else. Someone else may see results in 2 months. You might take 6 or 7 months. So please be patient. These are prescription medications. Your hair has to go through a couple different hair cycles for you to see best results. Now, product alert, guys. Super capsule ED formula. Uh, that's basically combines the finasteride with the 5 milligram tadalafil with 2,000 vitamin D. It is designed for patients who have in the past used the oral finasteride and had sexual side effects, or who are afraid of using the oral finasteride because of fear of sexual side effects. We also have our topical dutasteride basically bundle with the oral medication bundle. So the way it works is that you're bundling the super capsule pill, which combines dutasteride, minoxidil, and vitamin D with the topical dutasteride. So you're doing both topically and orally. The reason why we have the bundle is because we have seen when patients take something orally, the products work from the inside out. When applied topically, you're getting this local topical effect. So when you do both, it's called sandwiching, and those patients are the ones that we've seen see better results. So you could bundle them together, and it will help you a lot. Also, we have many different bundles. There are finasteride bundles and also dutasteride bundles. We like dutasteride, and the reason is because if you look at the clinical studies, oral dutasteride compared to oral finasterides, oral dutasteride showed better efficacy compared to oral finasteride, and the side effects were about the same. And if you look at the data, dutasteride inhibits two enzymes as opposed to one enzyme of finasteride, and dutasteride blocks more like 90% of DHT, whereas finasteride only blocks 70% of DHT. So it's a no-brainer that dutasteride is obviously a better drug. So this is why if you want to get started with the medication, we recommend doing the dutasteride formula, dutasteride super capsule. And if you really want to go for it, you could do the dutasteride super capsule along with the dutasteride topical, what we call the combo. Um, do you have plans on releasing a beard grower? Can we use the topical to grow beard? We are actually, that's in the works. You cannot use the regular topical because it has hydrocortisone in it, and I don't want you to use hydrocortisone on your face. The liposomal formula has no hydrocortisone in it. Is that correct? Liposomal has no, yes. So you could use the liposomal formula on your beard, the liposomal, but not the regular liquid, because the regular liquid is also going to cause irritation. So, by the liposomal formula, it's like a lotion. You could easily put it on. So, for the beard, you could use the liposomal. If we quit using your medication, will all the results be reversed or not? And how long will it take? I'm currently 33. So, look, with any hair loss medication, not just us, any medications, topical, oral, prescription, non prescription, when you start using the product, it takes 4 to 6 months for you to see the results, and once you see the results, you continuously have to use it. Otherwise, basically, the results are going to start to go away, and you're going to lose the improvement. Liposomal. What are the benefits of the liposomal? So first of all, the liposomal formula uh, is unique because it's 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 minoxidil combined with finasteride. It doesn't have the steroid in it. It doesn't have the aloe in it. It's not greasy. It's like kind of a nice cream lotion that you apply, and it's really non-irritating. I mean, people are really love the formulation. Doesn't smell. It's not irritating. Um, it doesn't make your hair sticky. The reason why we did liposomal is because it also has lower risk of systemic side effects. It doesn't get absorbed into your system. So who qualifies? Basically, anyone basically could use it, but particularly patients, who don't want to do the product twice. They only want to do it once a day. They don't want to apply something greasy on their scalp. They don't want to have the hydrocortisone in their bottle, and overall again much easier to use. Can females use this? Females above age 50 could use the liposomal formula. Is Happy at the first on the market with the liposomal formula? I believe we are. I think there could be another company that has liposomal, but ours is better. What makes ours better? Oh, here we go. Thank you. The reason is because we really spend like a lot of time basically in like formulating the product. It's a very high quality product. It has finasteride with minoxidil. Other companies have not figured out how to incorporate the minoxidil into the liposomal formula. So ours is finasteride with minoxidil, so the two ingredients compared to one. Ours is once a day compared to twice a day of others, and ours is better price. So ours is a little more affordable. Um, I've been doing this for 6 months, once a day instead of twice a day. Um, is this about which formula? Is the formula? Is it the topical? Okay, the formula, the topical formula is too greasy. Yes, but I've seen amazing results. Yes. So unfortunately, the regular liquid formula could sometimes be greasy. The liposomal is not as greasy. So if you feel the regular formula is greasier, switch over to the liposomal. All right, guys. Well, first, I thank you so much for tuning in. If you're a Happy fan, please give us a shout out or review on our Better Business page or Trustpilot. We really appreciate it. Again, our team of hair specialists are here to answer your questions. You can always give us a call or visit our website at happy.com/help to chat directly with one of our agents from 7 a.m. to 5 p.m. Pacific time. That's Los Angeles time. Again, if there's any questions, we are here to help. We're here basically to customize your products for you and help you with the hair journey. Thank you so much for my team here, Genevieve and Francesca, for writing all this stuff and making this AMA successful. We'll see you guys in a few weeks for another AMA. Have a beautiful day. Bye, guys.
That was amazing.